Everyone, my name is Osama Barghoud, and today I will be presenting a clinical case as part of my medical terminology course at Straighterline. The case is titled Headache and Dizziness in a 54-year-old man. I will walk through the patient's history, symptoms, diagnosis, and relevant terminology, highlighting how precise language supports effective healthcare delivery. This case involves a 54-year-old man with a 3-week history of dizziness, right-sided tinnitus, and a mild non-throbbing headache. He has also long history with migraines, but this time, unlike his usual migraine episodes, there was no visual aura, no nausea, and his medication, somatriptan, didn't help, which used it to do before. MRI revealed a 2 centimeter mass in the right internal auditory canal. Audiometry also showed moderate hearing loss on the right side, which is pointing to a more serious cause than just a simple migraine. We mentioned some demographics. Why demographics matter? Age and gender are important diagnostic clues. In this case, the patient is over 50, which increases the risk for tumors like vestibular schwannoma. Also, men have slightly higher risk for this type of tumor. Demographic details help narrow the differential diagnosis and guide appropriate testing and referrals. We can here do some breaking down for medical terms. Let's look at few relevant terms. We have here vertigo. Vertigo, the root vert means to turn, and ego indicates a condition. So vertigo literally means a turning condition, which makes sense because patients often feel like room is spinning even when they are still. And we have metastatic. The prefix meta means beyond or change. The root stat means to stand. And the suffix IC means related to. So metastatic describes cancer that has changed its location, spreading from the original site to other parts of the body. We have also labyrinthitis. Labyrinthitis, the root is labyrinth, refers to the inner ear structure responsible for balance. And the suffix itis means inflammation. So labyrinthitis means inflammation in the inner ear, which can cause dizziness, nausea, and hearing changes, very similar to the symptoms we have in this case. We noticed also some abbreviations. 3 abbreviations are worth highlighting. For example, MRI. MRI stands for a magnetic resonance imaging. It uses magnetic fields and radio waves to create detailed images. In this case, MRI was essential for detecting the 2 centimeter mass in the right internal auditory canal. We have also BP, means blood pressure. The patient's blood pressure was 120/70, which is within the normal range and tells us that his cardiovascular system is stable, not contributing to the dizziness. ENT. ENT stands for ear, nose, and throat. ENT, a medical specialty that handles hearing, balance, and inner ear disorders. Because this patient had hearing loss and balance issue, ENT involvement is essential for diagnosis and management. Differential diagnosis. The most likely diagnosis is acoustic neuroma. This matches the patient's hearing loss, tinnitus, and imbalance. MRI showed a 2 centimeter mass in the internal auditory canal, a classic site of this tumor. Migraine and labyrinthitis were ruled out due to symptoms mismatch and lack of infection, because labyrinthitis, it must have infection. Uh, about the medical terminology, why it matters. Medical terminology matters because it's a vital for safe and effective care. It ensures clear communication, reduces errors, and supports ethical practices. When providers use consistent terms, patient care becomes more accurate and professional. It also improves documentations, legal clarity, collaboration across the teams, etc. This case involved a 54-year-old man with dizziness, tinnitus, and imbalance. Imaging revealed a tumor consistent with acoustic neuroma. We reviewed key terms and abbreviations, applied differential diagnosis, and demonstrated how medical terminology strengthens clinical decision making. Mastering this language helps us provide better, safer, and more professional care. The sources used for this presentation supported both the clinical interpretation and the terminology explanation. Thank you for your attention.